Madam, are you able to see my screen, madam?
So your photo is visible to us.
Acha.
And
No,
screen is not visible.
screen is not visible.
No.
So, what should I do? So now my
Yes, yes. Yes,
visible.
sir. Screen is visible, but some.
Sir, your screen is visible now.
Yes, sir.
Visible now. Okay. So whenever you say, madam, I will start my this thing presentation.
Okay, sir. So I'm starting, sir.
Yes, madam, please.
Okay. Good morning, one and all present over here. Today we all are gathered here for second day of AICTE sponsored one-day short-term training program, STTP, on interplay between health, well-being, environment, and community pharmacy, organized by Sagar Institute of Research and Technology Pharmacy. On behalf of SIRTP, I, Dr. Ruchi Jain, Professor in SIRTP, SAGE Group, welcome you all the faculty members and participants from the different institute and industry of India. Here, I am briefing about the short introduction about the SAGE Group. SAGE Group means Sanjeev Agarwal Group of Enterprises. This group was established by engineer Sanjeev Agarwal in year 1983. Under his umbrella, there are four sectors: education, construction, media, and power. The SAGE Group has institutions and universities in Bhopal and Indore. Currently, this group has opened SAGE University in Bhopal. It offers various UG and PG courses in engineering, agriculture, designing, mass and journalism, law, management, computer, banking, and finances. There are more than 9,000 students are studying under SAGE. For more information, you can visit sageuniversity.edu.in. Now, I would request, today we have a speaker, Dr. Abhudaya Verma. Uh, on behalf of SIRTP, I welcome you, sir. Here is a short introduction about Dr. Abhudaya Verma, sir.
Sir,
Dr. Abhudaya Verma has done his MBBS from MS Ramai Medical College, Bangalore. He did his MD from RGUHS Bangalore in 2005. He has done DNB training in endocrinology from Medwin Hospital, Hyderabad, India. He has Fellow of American College of Endocrinology, FACE, in 2018. He has done annual training course in endocrinological techniques and their application from National Institute of Nutritional, Hyderabad. He has done endocrine training at All India Medical Institute of Medical Science, New Delhi, AIIMS, in Department of Endocrinology and Metabolism, and Department of Endocrinology, Indraprasth, Apollo, New Delhi. At present, he is working as consultant endocrinologist in super specialty endocrinology and women care center, Seva, Palasia, Indore. He has 20 international and national publications in index journal. He is a reviewer of many international and national index journal. He has experience of counseling, workup, management of bariatric surgery patients, Medwin Hospital, Hyderabad. He has a membership of American Association of Clinical Endocrinologists, Endocrine Society USA, Endocrine Society of India, Indian Society of Pediatric and Adolescent Endocrinology, All India Association for Advancing Research in Obesity, Association of Physicians of India, RSSDI, Indian Thyroid Society, Indian Medical Association, He has got Best Paper Award at AIAARO in 2008, Hyderabad. He is doing social services like regular health awareness camp in community and society for diabetes, obesity, and thyroid disorders. He has doing regular health awareness lectures, articles on television, radio, FM, newspaper, and magazines. He has contributed data in various studies done nationally for non-communicable diseases. He is a American Diabetes Association certified speaker. He has delivered lectures at international and national and state level CMEs and conferences. He is invited faculty at various national and state level conferences like SCCon 2016 New Delhi and many more. He has worked as secretary in Diabetes Association of India Indore chapter. He was clinical secretary in Association of Physician Indore chapter. He was clinical secretary in IMA Indore chapter 2013. He has recently received Best Upcoming Endocrinologist Indore 2019 by Bhaskar Newspaper Group. Now I request Dr. Abhudaya Verma sir to please start his session.
Thank you, madam. Thank you for a very exhaustive introduction. I think this was not required, but I thank you at the outset, the organizing team, for giving me an opportunity to share few of my views regarding the health and wellness. See, because I think now with this pandemic going about COVID or Corona, we have become more health aware now. But I would say that the bigger epidemic we were already having from past 30 to 40 years was about non-communicable diseases. Non-communicable diseases means like diabetes, hypertension, obesity. These have already become a pandemic like Corona. Maybe this, we were talking about Corona a lot in the media, in our routine day-to-day talk. That's why we are more aware of this COVID-19 pandemic now. But equally effective is our lifestyle disorders, which is already there with us since long time, and we know that how diabetes, hypertension, heart disease, cholesterol problem, they are increasing diseases and morbidity and mortality in our public health. So in view of this only, I have today chosen a topic, metabolic syndrome, or which is known as syndrome X also, because this takes care of lot of our problems, which is known as non-communicable disease. Non-communicable disease are like basically the diseases which are due to our lifestyle, means which are man-made, I would say, because of our urbanization or rapid industrialization and our bad eating habits. Non-communicable diseases are different from communicable disease. Communicable diseases are diseases like maybe malaria, tuberculosis, and other infections on which we have already taken a good control. But now we have problems of this metabolic syndrome. And why I am saying metabolic syndrome, because it takes care of most of the problems which we are facing nowadays. So in the beginning, I will start with the introduction, then the definition of this metabolic syndrome, then the epidemiology, the pathophysiology of this metabolic syndrome or syndrome X, and then very brief, I would be talking about the treatment. So now here we can see the introduction, that what is the metabolic syndrome. This is important for us to understand. So until unless we understand what is metabolic syndrome, this is basically a major and escalating health issue, and it has become a clinical challenge worldwide. in the context or wake of urbanization and this surplus energy intake. We all know that how much we are eating daily. Sometimes we are eating unnecessarily also, maybe just for socialization, which is increasing the obesity. And this has become a biggest problem now, obesity. We are now in an era where lot of us are eating unnecessarily and increasing our weight. And on the other side, we can see lot of people who are not having a single meal also. So this is a very imbalance happening throughout the world, that sometimes there is a over and some places there is a scarcity of the food. And on top of that, the biggest problem is the sedentary lifestyle. You can say that our day-to-day activities have reduced. We have so many um, things which help us, so many times we avoid doing physical activities, small household works we are not doing. So this has led to this metabolic syndrome. And we can see here that metabolic syndrome, it confers fivefold or 5 times increased risk of developing type 2 diabetes in future. So you can see what I will talk about, the basic components and of metabolic syndrome. And we will see that how this metabolic syndrome, we can see that this is so common everywhere. And this metabolic syndrome will increase 5 times the risk of getting diabetes. And this is the reason
Ma'am, I think sir is not audible. I
Sir
think.
has disconnected. What can?
No, ma'am, sir is connected with us, but I think there is some network issue.
Dr. Abhudaya, sir.
Ma'am, sir has got disconnected with us through his laptop. So I request all the participants to please be with
Please stay
us.
connected.
Yeah, sir is connected. Yes. Uh, Sir, kindly unmute yourself. You are not audible, sir.
yeah, sorry, I think there was some problem with my so are you able to
No, sir, we are not able to hear you.
okay, so I'll share my screen again. Sorry for the technical this thing problem. So is it visible now, madam?
Yes, sir. Yes, sir.
Okay. So, and we can see here about the heart disease also, that how this increases our chances of getting heart problems also. So with metabolic syndrome, there is 2 times increased risk of getting a heart disease also. So we can see that just by this introduction, you can see that how these things are so common in our society. We can all correlate because we know that there is a rapid urbanization, increasing weight, sedentary lifestyle, and definitely all these are increasing our chances of getting diabetes and heart disease in future. So when we talk about definition, so we have understood, but there is a definition of this metabolic syndrome, that this is basically a constellation of various interconnected problems of physiological, biochemical, clinical, and metabolic factors that directly increase the risk of atherosclerotic cardiovascular disease and type 2 diabetes mellitus, causing increase in the mortality. So this is the exact definition of this metabolic syndrome, what we can say that it is not a simple thing. It is basically everything involved: the physiology of the human body, the biochemical changes in the human body, the clinical changes what we see, and then various metabolic factors. So this is a basically a imbalance or the interplay of the whole system of the human body, leading to increased risk of cardiovascular problems and diabetes. And here we can see by unhealthy body measurements also. Like body measurements, basically it is our weight first we take, so it is unhealthy weight gain. Then that is according to the BMI also. We know BMI. What is BMI? BMI is height and weight proportion. In Indians, if it is above 23, we say it is overweight. If it is more than 27, we say it is obesity. So the body measurement, and amongst them, the most important is the waist circumference. Waist circumference is the most important factor here, especially what we talk about the abdominal obesity. Means ki if we have obesity, especially the central obesity, means the abdomen, our stomach, where we have more obesity, that will cause more problem in increasing this metabolic syndrome. And then we have abnormal laboratory findings also, like dyslipidemia or abnormal lipid profile is there. Some people will have hypertension, maybe the beginning of hypertension, but if there is a slight hypertension also, that also will increase the risk of our metabolic syndrome. Then we have impaired glucose tolerance. So it is not diabetes, this is a impaired glucose tolerance. Impaired glucose tolerance where we have borderline diabetes, means we have slightly increased blood sugar levels than the normal levels. And many we have seen patients who are diagnosed with this impaired glucose tolerance long back, many months or years back, but they have not taken care of this impaired glucose tolerance, which has led to increase in the risk of heart disease and diabetes. So, and then we have pro-inflammatory state and pro-thrombotic states, means we have problems which causes damage to our other organs also, and which causes increase in atherosclerosis or plaque formation in a patient. So we can see that how this metabolic syndrome is so important for our normal functioning of body. And this is the International Diabetes Federation, the what are the requirements or what are the prerequisites to call somebody as metabolic syndrome. And here you can see, if you see this slide, you will definitely feel that I think most of us are suffering from metabolic syndrome. So as I said, first and most important thing in metabolic syndrome is central obesity or waist circumference. Here you can see, and I think most of us, especially Indians, we have abdominal or central obesity. We have increased waist circumference. So this is the one and the most important thing for metabolic syndrome. So along with this central obesity, they say any two of other these findings also: raised triglyceride levels, low HDL levels, raised blood pressure. So if blood pressure is slightly more than 130 or 85 also, you know, a lot of people we know, they say, sir, my blood pressure is 140, 142, that is okay, I should not take medicine. Yes, that is okay, you may not take medicine, but still more than 135, 130, you are at risk of developing metabolic syndrome, or you may be already having a metabolic syndrome also. Then fasting blood sugar levels more than 100. So here you can see lot of people, they come to us, sir, my fasting is 102, my fasting is 108, 106. So that means that you are having pre-diabetes or impaired glucose tolerance, which makes you at risk of developing metabolic syndrome. And as I said, the BMI. So again, the weight is the important thing. So if BMI is more than 30, if somebody's BMI is more than 30, we need not check the waist circumference also. So earlier I said waist circumference is important, but now if somebody's BMI means if somebody's weight is so high, then definitely if somebody is like 90 plus female or 100 kg plus male, then you need not check the weight also. You can directly say that this person is suffering from metabolic syndrome. And I have already told you that how metabolic syndrome can increase our risk of getting diabetes and heart disease in future. So this is the basic. You can see the whole picture of the metabolic syndrome, that it can cause hypertension. Then we have low HDL, which is a good HDL, what we say cholesterol, which helps us prevent a cardiac problem. Then we have insulin resistance. Insulin resistance is one of the very key problems in the causation of this metabolic syndrome. And I would say that almost 3/4 of Indians are suffering from this insulin resistance. Then we have visceral obesity, is same like central obesity, and high triglyceride levels. So here you can see that if we put ourselves, lot of us must be having some component of metabolic syndrome, maybe a slight hypertension, maybe slight low HDL levels, slightly high triglyceride levels, insulin resistance, visceral adiposity. So that's why I think I chose today to talk about metabolic syndrome, because this is very common in our Indian population. We are already born with some component of insulin resistance. As we grow up or as we age, we have increased central adiposity. So we all someday or other we start having metabolic syndrome, and we should take care of this metabolic syndrome. So what is the epidemiology? So now we'll see. This is basically the worldwide, but India, I would say we are far worst condition than this total world data. And here you can see that it can range in world. That's why they have shown that it can range from 10 to 80% depending upon the region, the country, the rural or urban population, and according to the sex also, race, age of the person, and ethnicity of the person. But still, the International Diabetes Federation, it says that at least 1/4 of the total world is suffering from this metabolic syndrome. That's why I said that now we can see that how big is this pandemic. I don't think that 1/4 of our population is still infected with the COVID-19 infection, but still we are much aware of this. We are talking about it day and night. Media is behind that, and we are taking care also of this. But you can see metabolic syndrome, 1/4 of our world population is affected by this, but still we are unaware that what is happening inside our body and putting us at increased risk of these problems in future. So what are the basic problems associated with this metabolic syndrome? The cause is the higher socioeconomic status. As we are earning more, we are putting ourselves more at risk of these health problems because of overeating, especially I would say cheap available food which is more in fats and carbohydrates, where we have now easy availability. We say maybe whatever, a kachori, a samosa, easily available everywhere in the market. We have now various junk food outlets easily available. Anybody can go, and they are quite cheap also, so easy to get. cheaper also, but they are not at all healthy. So these are the problems which are increasing the metabolic syndrome all over the world. And obviously then there are some other factors also, like genetic background. As I was saying from beginning, that Indians, we have some genetic background which puts us more at risk of this metabolic syndrome. Maybe a person who is of same weight in US or Europe may not have a metabolic syndrome compared to a person who is having same weight in India, because of the genetic background. We were born with some risk of this metabolic syndrome. And what has made the things worse is our diet. We have moved away from our traditional diet, cultural food. We have gone to more sophisticated, more refined, fatty, and oily foods. Then our levels of physical activity has also reduced. We used to run around, walk, do cycling, um, do lot of physical activities at home also, but now these things have reduced totally. So there is lot of energy intake, but there is no energy expenditure at all. So we are getting overweight, obese day by day, which is increasing this metabolic syndrome. Then if somebody has a family history of diabetes, and then obviously the education, it is seen everywhere, that where the people who are more educated, so it's not about only the degree, it is basically the education or the awareness about the health, that how people, they take their health, if they take their health as a priority, definitely it is seen in US and European countries that people have become more aware now about their health. They do routine exercise. They have food labelings on the food packets where they can really know that how much fat they are eating, how much sodium they are eating. You know, all these things are there. So it is basically the increasing the education level or the awareness level which has made a difference all over the world. Now coming to the pathophysiology, the pathophysiology is basically very complicated, I would say. It's not basically complicated, it's due to the general involvement of the whole body, because this metabolic syndrome is not related to only one specific organ. This is basically the disturbance in the whole body's metabolism. So this is a state of low grade inflammation which has a complex interplay between genetics and environment. So this is basically a total, that how a human is reacting, how a human is living himself and according to the environment. So environment is not only the atmosphere in which we are living, it is basically our family, it is basically our society, and it is basically our whole countries, you can say the whole country, how we have health policies here. So it is basically an interplay between how we are born and then how we are brought up in our society or in our family. And the main components of this, or the main cause of metabolic syndrome, is insulin resistance, as I said. So I would again say Indians are born with this insulin resistance. Every one of us are born, we are born with insulin resistance, and I have already shown that how this insulin resistance is the main thing in causation of metabolic syndrome. Then the visceral adiposity, the dyslipidemia or the lipid profile derangement. Then we have endothelial dysfunction. So this is the lining of the blood vessel. So when from beginning itself we can see if there is a endothelial dysfunction, the blood vessels, they have improper metabolism, they become more atherogenic. Then we have increased risk of these cardiac problems and other health issues. Obviously I have talked about the genetic susceptibility, a slight increase in blood pressure. That's why we say that we have to take care. If we have increased slight blood pressure, also increase slight weight, also increase in slight sugar levels, also don't take it very lightly. You should be aware. Means I don't say that you start taking medicines from the beginning itself, but try to at least be aware, become more educated regarding your health, that yes, I have started some problem in my body has started, and I should take care by good diet and regular exercise. And then the most important thing which we all have, the chronic stress in our work, day to day life, whatever we say, we have office problems, we have home problems, we have other administrative lot of issues. So there is a chronic stress. It is not only that at work we are having stress. I think we can have stress while at home we can have stress. So this is a chronic state of stress, which is again putting all of us at a risk of this metabolic syndrome. Abdominal obesity, I have already talked a lot about this. And now, as I was saying, this is the obesity epidemic going on in world, which is more dangerous than this coronavirus, because we are not aware of this, we are not taking good care of this, which is driven by cheap calorie dense food and reduced physical activity. What happens when there is increase in adiposity? The adipose tissue responds rapidly to these calorie dense food and causes alteration in nutrition through adipocytes, hypertrophy and hyperplasia. And this enlargement of the adipose tissue or the cells and the blood supply to adipocytes may be reduced, leading to consequent hypoxia. So it is basically the imbalance or improper, the supply of oxygen is reduced according to whatever the increased adiposity or fat tissue we have in our body, which leads to lot of metabolic changes. We'll see here now that what this hypoxia, this is the main inciting etiology which causes macrophage infiltration into the tissue that leads to biologically active metabolites known as adipocytokines. And these are the main problem. It is not the fat. See, we are now in an era where we don't take fat as just a cosmetic issue. This is basically a metabolic issue. We can see here that how the increased fat leads to hypoxia, and this hypoxia leads to adipocytokines like free fatty acids, pro-inflammatory mediators, TNF alpha, interleukin 6, CRP, plasminogen activator inhibitors. They are the deadliest enemies of our health, we can see. So just by increasing fat, you can see that how our body is at a risk of all the problems. See, these free fatty acids, adipocytokines are throughout our body, and they damage each and every organ of the body from head to toe. We have seen, you might have heard and seen reports also of CRP, interleukin 6 also in COVID patients. They do. So these are basically these the pro-inflammatory mediators which were increased. And we have seen patients, and we have compared also patients where we have seen already a obese person, already a obese person, he was having these increase in inflammatory markers, and when they had COVID infection, they had more of these interleukin 6 and CRP, which made them more prone for any death or increased problem with the corona infection. And same is with diabetes also. That why diabetes is again an inflammatory state. with increase in these TNF alpha, interleukin 6, plasminogen activator inhibitor, CRP levels, they are already increased in patients who are having uncontrolled diabetes or blood pressure. And on top of that, if somebody gets a corona infection, this will increase and it will cause more problem to the person, and sometimes it may result in fatality also. So these adipocytokines result in localized inflammation initially. So maybe if the fat has just started or it is just a visceral adiposity, there is a localized inflammation. But then as the fat increases in our body, or as the BMI increases in the body, we can say that leads to overall systemic inflammation. So there is a chronic state of inflammation in the body, a continuous inflammation. Maybe you can say that this process starts at age of 20 years, 22 years, and this chronic inflammation goes from localized to systemic inflammation over the years, and then the person starts getting diabetes, hypertension, cholesterol problems at the age of 30 years. So this is so important. You can see the seed was sown almost 10 years back when the blood pressure or diabetes or any other these problems were started, almost when the person was 20-22 years of age. But if we have not taken care of our lifestyle, our health, our weight, our physical activity, over the years, the chances of blood pressure and diabetes risk increases. So this is not that suddenly somebody has gone. A lot of people, they come to us, they say, sir, I was okay 1 year back. The diabetes or blood pressure has come suddenly. We say, no, it is not sudden. It is the whole process of this inflammation from localized to systemic, and then getting to damage your organs, and ultimately the symptoms or signs, they come after 5 to 6 years for us. So this is the whole same presentation about which I have talked. High caloric intake, the hypertrophy, the hypoxia leading to inflammation, and ultimately the overall systemic inflammation. And it affects the whole body system. Free fatty acids, I will not go in detail, but here, yes, we should just know that this hypoxia, this increase in fat ultimately leads to increase in free fatty acids and causes first liver fat accumulation. So first we can see, whenever we see lot of patients, lot of females getting normal routine sonographies, and you can see there is liver fat, grade 1 fatty liver, grade 2 fatty liver. This has become more common. Why this is so more common? Because all of these are suffering from metabolic syndrome, but they are not having blood pressure or diabetes. And we should become aware at this point. When we start getting liver fat, that means our metabolism is disturbing. Why it is disturbing? Because it is sign of free fatty acid. Free fatty acid is a sign of chronic inflammation. So this is the whole process. If we go back, we can see here that ultimately our weight, our lack of physical activity has caused all this problem, and this leads to insulin resistance. So now the start of diabetes occurs. There is an insulin resistance because of all these fatty acids, and along with these free fatty acids increase fibrinogen and plasminogen activator inhibition 1 production, which leads to increased atherosclerosis or clot formation in our blood vessels. So this increases the risk of diabetes and heart disease. TNF alpha also, again, this is a part of that same chronic inflammation. It is positively associated with body weight, waist circumference, the lipid profile derangements, and this is all because of the increased inflammation due to increased body weight. The CRP also, we have seen, it predicts the CVD mortality. It is a predictor of non-alcoholic fatty liver also, or just fatty liver also, what we see or what we say. And it is seen increased in patients with insulin resistance. So these are basically all interconnected. One thing leads from localized inflammation to the whole systemic inflammation. And interleukin 6, I will not talk much about this. We have already seen, again released by adipose tissue and skeletal muscles also. It has both inflammatory and anti-inflammatory action also, but it depends on the situation when it is increased. So this is a systemic adipokine which not only impairs insulin sensitivity, but it's a major determinant of hepatic production of CRP. So, and it is related to our fasting insulin levels, our HDL, our BMI. So this is all interrelated. You can see that how one or small increase in weight leads to a cascade of the whole process. The whole process has started because of a slight increase, and we take it very lightly that okay, I have just put on 4 kgs, I have just put on 3 kgs, but you can see that how this whole process has damaged our body. And same is with the PAI1 also. It increases the risk of intravascular thrombus formation. Adiponectin, yes, this is good, but it is seen that it inhibits the hepatic gluconeogenic enzyme also. It is inversely associated with cardiovascular risk. So these things also become irregular. Then we come to a very important, the leptin hormone. Leptin hormone is getting very big attention nowadays in our endocrinology, or when we talk about obesity, diabetes, and hypertension or heart disease. It is involved in regulation of satiety and the food intake. Leptin levels increase during increased weight and decrease with weight loss also. So this is a very good this thing. You can see that these are interrelated. If you increase weight, your leptin will increase and it will increase more hunger. So this is a vicious cycle. You put on more weight, you will get more hunger because of leptin, and this will keep on increasing. So ultimately, with weight loss, we can get decrease in this leptin level, which will help us reduce our appetite also. So this is a vicious cycle, and these receptors are located mostly in the hypothalamus and the brain stem. And this is the most important thing, especially why we Indians are more prone for diabetes and other metabolic problem, the insulin resistance. This is the main pathology behind our metabolic syndrome or syndrome X. And this is the complex. I will not go in this diagrams detail because we have to just think. These are all, in short, I would say the inflammatory process going in our body, which causes reduced vasodilation. So there is a vasoconstriction, increase in inflammation and oxidative stress. So there is insulin, because of insulin resistance, it is not only the blood sugar levels, the whole endothelium, the whole blood vessel system, the whole process of the body is damaged. So this is how insulin acts in normal condition. We all know there is, if there is a increase in blood sugar levels, there is release of insulin from the beta cells, and there is a uptake by GLUT4 in adipose tissue and muscles, which leads to utilization of glucose in these cells through insulin. But what happens in insulin resistance? If this cell phospholipid membrane is not fluid enough, or it does not contains PUFA for the permeability, insulin receptors are disrupted. So again, this is the increased fat here. You can see that it does not bind to the receptors, thereby there is increase in the blood glucose level. So the glucose is not taken up by the fat tissue or the cells, which increases slowly our blood sugar levels, and then the person becomes diabetic. Without insulin, muscles are unable to use glucose, and therefore there is a release of glucagon from pancreas. Glucagon further increases the blood glucose levels, and it again increases the free fatty acid production. So again, this will increase the inflammation in the body through lipolysis or breakdown of stored lipids in the thing, and ultimately leads to increased in lipid levels also. So we have seen earlier slide, there was increase in blood sugar levels, and now we have increase in the cholesterol levels also. So we have insulin resistant states where a person blood sugar level increases and the he reaches a state of impaired fasting glucose or impaired glucose tolerance. And as the glucose level increases without any intervention, there is a chance or high risk of getting diabetes. So it was about diabetes and insulin level, but then the factors which influence our insulin resistance, it is basically through the diet, especially the saturated fat, which appears to be most effective or the main problem causing insulin resistance. So high fat diet is the main culprit of this insulin resistance. PUFA, polyunsaturated fat, these are good, but when our diet has got more saturated phospholipids, then the fluidity or the permeability of the membrane is not maintained, and again there is a insulin resistant state which leads to problems like increase in blood sugar levels and the cholesterol levels increase. Then we have advanced glycated end products, and here you can see there is in this diagram the ages they bind to the receptor leads to reactive oxygen species generation, again increase in the inflammation, again the same problem affecting the cardiovascular system, causing diabetes, kidney problem, Alzheimer's disease, sarcopenia, lot of and rheumatoid arthritis also. So here you can see that how the whole process from where I started, it was started with the slight increase in the your weight, then it went on to the slight inflammation, diabetes, heart disease, cholesterol. Now it has started affecting kidney also, increase in the chances of rheumatoid arthritis also. So this is the whole metabolic syndrome which is causing the problem. And obviously this I have already told, the dyslipidemia, that as this inflammation increases, there is increase in the lipid or cholesterol levels also. And a lot of people, they come to us and they say that, sir, I don't eat much oil, but why my cholesterol is increasing? So this is the main problem. You can see here, it is not the amount of fat, it is sorry, the amount of oil what you are eating, it is the amount of fat in your body which is causing chronic inflammation and ultimately leading to all these problems, increase in free fatty acids, substrates, including the insulin resistance, which is increasing your lipid level. So it is not directly what you are eating, it is basically your weight which is contributing to your cholesterol levels. This is same, I will not go in detail. This is same what I have told, increase in free fatty acid levels, increase in triglyceride levels, increase in oxidative stress leading to endothelial dysfunction and ultimately atherosclerotic vascular disease. Hypertension, again, hyperglycemia or increased blood sugar levels, hyperinsulinemia, they act on the kidneys by RAS system, increasing the expression of these angiotensin 1 and angiotensin 2 receptors, which again causes hypertension in patients. So this is the problem. Again, you can see here that how they are correlated. Your increase in insulin level and your increase in slight increase in your sugar levels will activate this RAS system, and this RAS system will increase your risk of developing hypertension. So this problem has caused one more problem. So insulin resistance and hyperinsulinemia leads to sympathetic nervous system accumulation, leading to increased sodium reabsorption, which increases the cardiac output and cause vasoconstriction, leading to hypertension. Then we have genetic factors with which we are born. This we can't say, we can't change. These some genetic factors, especially South Asians. What I was saying, we are born with a gene known as thrifty gene. There is a thrifty gene effect where we are already born with these risks of developing diabetes, heart disease, hypertension, low HDL, and high triglyceride levels. So we are born with this. But then environmental influences also there. So in the way we are eating, again the family, the society, all these they contribute to these environmental influences. Then the chronic stress. Now I would explain that how this chronic stress, as I was saying, everywhere throughout the day we are having chronic stress. This leads to increase in some stress mediators like cortisol, which leads to increase in fat. So now you can see here that it is not only the accumulation of your fat, it is not only the eating what you do, it is your stress also, which is causing increase in your weight. So chronic stress throughout the day from morning till we go to sleep, if you have chronic stress, this itself can lead to increase in your weight. And you have seen if the weight increases, then how the whole process starts and leads to all this problem. So now the chronic stress has also become very important. That's why we are moving in an era where we say now that more than exercise, more than your physical exercise, your mental peace is also important by meditation, by yoga. That's why now we prescribe to a lot of our diabetic patients, hypertensive patients, heart patients to go for relaxation techniques, go for meditation. These steroids or the cortisols, they stimulate amino acids, which again leads to lipolysis and peripheral insulin resistance. So this is the whole pathophysiology. The same pathophysiology occurring with different things, which again I would say that it happens in our day-to-day practice. And we say that how suddenly I have got diabetes, why suddenly how I have got hypertension or heart disease. This is the whole process which I have shown. And obviously, this is the main factor, the sedentary lifestyle. It increases the chances of insulin resistance. So here you can see that how our lifestyle. So we should be more active as much as possible. Try to move, try to walk for small things. You can just park your vehicle a bit far, take a small walk to the college, take a small walk. Otherwise also try to use less lift. If you go for shopping, try to walk, avoid autos, avoid small uh, means commutation through your two-wheeler or something. So these are small things which we can really take care to keep ourselves active in our day-to-day practice. So sedentary lifestyle, we should try to take care of our sedentary lifestyle. So I think now this is my last slide. I will not talk much about the treatment because I wish that we should be more aware. We should try to prevent these problems. Treatment is the last part, I would say, when everything has failed, when we are not aware, we have not taken care of our lifestyle, or there are some reasons which has prevented us from doing these healthy habits, then only I say that we should go for the treatment. That's why I have made a very small slide of the treatment, that lifestyle modifications are required, weight reduction is required, at least 500 kilocalories per day. So this is a small thing. 500 kilocalories is not much. If we save one samosa, one kachori, this thing, or maybe half of kachori, some chips, wafers, or some half a bowl of some sev or mixture, if we reduce, we can reduce easily 500 kilocalories of our food diet, more with PUFA other than saturated fatty acids, and obviously physical activity. So this is what I want treatment, that our main aim to reduce this pandemic or epidemic of the whole metabolic syndrome, which we have seen can lead from diabetes to even arthritis also, can be reduced by these small lifestyle modifications. And otherwise, we all know we are there for drugs, for pharmaceuticals, we are there, our profession is there. So obviously we have appetite suppressants also available. We have phentermine, sibutramine was available earlier in the market, but due to various problem it is withdrawn. So ultimately I would say even the drugs are not working well. It is basically our lifestyle which we have to take care. Then we have the nutrient absorption inhibition through orlistat, which works okay, but then it needs good dedication of diet, exercise also. We have metformin also, where it can help us reduce the insulin resistance. We have obviously antihypertensive, statins, aspirin to reduce this inflammation and the dyslipidemia also. And ultimately now the era has come of a big shortcut, bariatric surgery. Okay, no problem, sir. My weight is 100, 125. Somebody has suggested me to go for bariatric surgery because I don't want to exercise, I don't want to walk, but I want to eat daily. So what is the shortcut? Go for bariatric surgery. But bariatric surgery is also not a simple surgery. We know it has got its own complications during the surgery and post surgery also. Lot of malnutrition has occurred because of bariatric surgery, because it is a procedure of malabsorption, that what you are eating will not get absorbed. If you eat 10 kgs, only 2 kgs will absorb. So you are eating more, but your body is not able to absorb. So with this malabsorption, what happens, that other things are also not absorbed in your body. Lot of nutrients are not absorbed in your body. So ultimately the person becomes cachexic, they become malnourished, they become devoid or deprived of micro and macro nutrients. So in the end I would say that this was my effort and the team sage effort to create awareness about health. And as pharmacists, I request you all, there are a lot of studies. In India, we don't have, Gulf countries we have, European countries we have, where community and clinical pharmacists, they have become aware about this metabolic syndrome, and they have taken part, active participation. A lot of studies are there I have seen, and this was my first time where I really saw that how community pharmacists have really taken care of this metabolic syndrome. And I was surprised, since last 10 years a lot of studies are there, and the latest study I saw was a review article of almost more than 40 to 50 studies in 2020 June itself it was published, and where they have shown that how a community pharmacist can help people diagnose this metabolic syndrome, make people aware at community level itself about this metabolic syndrome, about the impaired glucose tolerance, about slight increase in the weight, about slight increase in the blood pressure. so that if people are made aware through community people like pharmacists, then we can create a big awareness. See, to a doctor, when patient comes, he is already diagnosed with a problem. We are trying to prevent the disease. So until unless we have a participation of community pharmacists, we can really make aware the public, it will not be possible to improve this pandemic. Thank you.
Thank you very much. Now I request the participants to please, if you have any doubt, please ask freely to Dr. Abhudaya sir.
Good morning, Professor Abhudaya sir. This is Sukhwant Singh. I am Associate Professor at SIRT's Pharmacy. Sir, I would like to share a small it's a personal kind of issue. My niece is suffering from type 1 diabetes, and her age is currently 13 years, 1-3. So we are trying with a lot of combinations like Lispro we are trying, and she's taking 2 types of insulins as such, but still we are not able to find a very good control over her sugar profile, sir. And since she's a child, she also has cravings for a lot of things because she goes to school also, and when she goes to, she meets other students who are taking a lot of type of inputs. So we try to control her, but we are not able to console her mentally as well as physically. We are not able to control the this situation right now. So sir, how should we approach? And another thing that I would like to ask is that we actually did a lot of searching online, and there was a clinical trial that was going on in somewhere in Norway, and in as well as in USA, and they are taking trials of two new molecules, and one of the therapies to also go for implantation or the organ replacement therapy. I would like your input on the same, sir. What should we do
Yeah,
as
yeah,
concerned parents?
very valid point, and a lot of people are worried, especially the relatives of type 1 diabetes, because the problem is diabetes at a very early age, and the second problem is the injections. So obviously, as you said, with Lispro and other injection, maybe a basal bolus therapy is going for her,
Yes, sir.
which means 3 to 4 times injection a day, which
Yes, sir.
itself is a very big disheartening for any relative, any parent, or even for the kid also. But I would say that, as you suggested, that age of the child, which is 13 years, this is a very you can say critical age regarding the growth also, regarding her reproductive cycles also, and the glucose management also. So in this age, definitely there will be lot of glucose variability, there will be hypos and hyperglycemias,
Yes, sir.
and we have to just take care that her sugar levels remains in a range. Don't try to go for good strict control, because this will never happen, especially when the hormones are fluctuating, when there are a lot of changes are happening in her body. She is growing up, her demands are increasing for energy intake, so a lot of things are happening. We have to just take care that everything stays okay. Don't go for very strict control.
Okay, sir.
And then the next question is about the latest happenings in management of type 1. So I would say yes, lot of studies we have tried with these pro-inflammatory marker inhibition also, which I was talking about, which again leads to type 1 diabetes or pancreatic destruction, but they have not proved to be that helpful. Lot of studies are done with the stem cells also. Few of those patients or recipients have had some recovery from diabetes, but still I would say that we are in a very early stage where we can say that we have a real cure for type 1 diabetes.
Thank you, sir. Thank you so much, sir. And sir, regarding another thing, since she's into, we try to control her, but the thing is that we are not able to cope up with her mentally also, because she, she starts being at a nascent age. She starts questioning, why did God give me this kind of problem, etc. So she compares that also. So do we need to consult a counselor, or
Yes, yes, yes.
handle it
I,
from our
I would I would say I would say yes. Earlier, kids were not that means you can say aggressive
Yes,
about
yes,
their health and about their well-being. Whatever was given to them or whatever was taught to them, they were able to take it easily. But now they question everything. So I say definitely yes. At this tender age, where she should have a good self image, where should she should get a good confidence also,
yeah, yeah,
definitely
sir.
I
But she's
say
lacking.
that yes, she should, because see, already at this teen age people become more rebellious, you
Yes,
know.
sir.
So
That's
with
defined.
a counselor, definitely yes, you should take help of a counselor who can really make her understand about the exact situation.
Right. And so another thing, is there any pre-biomarker? For example, my kids are also, she's my niece, my brother's daughter, and I too also have two kids. So do we need to look into genetic aspects, whether it can come over to our kids as well?
Genetic, no. See, usually type 1 diabetes, no, we can say genetic predisposition is there. But yes, you can just see, for a niece it's not a problem. Maybe with, you can say, the immediate brothers and sisters it may be a problem, but
Mhm.
usually also we don't say. So I don't think a regular or routine monitoring or any testing is required.
Okay. Okay, sir. She has a sister, but she's fine. I'm worried about my
Yes.
kids, whether is there any,
No, no, no. For
can.
you, for you or your kids, it won't be a problem.
Okay. Thanks a lot, sir. Thanks for this personal input, sir. Thank you. And it was an awesome lecture, sir. You incited a lot of interest in the lecture, sir. Thank you. Yes, Ruchi ma'am, Survi ma'am.
Yeah. If any of the participant, if they have some query or if they want to share some experience, so you can also write in the chat box, or else you can unmute yourself and ask to sir.
सर आई वांट टू आस्क वन क्वेश्चन।
जी मैडम।
सर अगर जैसे किसी को इम्पेयर्ड ग्लूकोज टॉलरेंस हो जाता है, इंटॉलरेंस, तो वी कैन रिवर्स इट और नॉट?
Yes, yes, madam. This is a totally reversible state. And I would say that this is the only reversible state from where you can come back to normalcy. From this stage, if you go to an increased level, which is diabetes, then definitely you cannot come back. You cannot. Lot of people they say, sir, अब मैं ध्यान रख लूंगी, अब मैं खान पान पे कंट्रोल कर लूंगी, वजन कम कर लूंगी. No, because that stage has gone. Stage at which you can really make a difference is the impaired glucose tolerance. So again, lifestyle and lifestyle. Take care of your diet, eat more healthy food, lot of fibers in your diet, less fatty foods, regular exercise, and above all, maintain your weight. So this is the only thing which will help you reverse the diabetes. And I have seen a lot of people, they have very strong family history of diabetes. They were at a risk of getting impaired glucose tolerance, but with good diet and good exercise, weight control, they have not got diabetes for 5, 7, 10, 15 years also. So with good lifestyle you can delay the progression of diabetes.
सर ऐसा देखा गया है कि जैसे जब चिल्ड्रंस 10 to 12 एज में होते हैं, तो दे स्टार्ट ईटिंग मोर फूड्स of outside like junk foods, and we are not able to control over their choice and all these things, and they become obese. So how to control
Yes.
these situations?
This is again, see, this is a age where, again, as I say, teen age, they don't listen to you. And definitely as they are growing, they get more interest in things which are not good physically and mentally also. So only our thing should be to just guide them, to give them a good and bad experience, that which is good and which is bad for their body. Don't restrict anything, don't stop them, say that yes, you can take anything, do anything in moderation. But if you eat on Saturday a pizza or pasta, then Sunday you have to work out for half an hour, 1 hour. So that will balance both the things. That will take care of their extra energy also, or I would say the extra josh what they are having inside in that age. If you channelize that through good exercise, their mental, physical health will be okay. And then if you let them one day to eat little bit also, which is okay, not very bad for their health, then I think we can balance both the things.
Thank you, sir. So one of the participant has raised his hand, Dr. S. Nayak, sir. Sir, kindly unmute yourself or you can ask the question, sir.
Thank you, madam. Sir, in case of treatment treatment with psychotoxic drug like prednisolone, the sugar level is increases sometimes.
Yes.
So, what type of therapy you suggest to control the glucose in the body in the case of treatment with the psychotoxic drugs?
Yes, sir. This is always a problem. Even now, with our COVID patients, we see a lot of patients, they are getting these anti-inflammatory drugs like remdesivir or even glucocorticoids, steroids also, which increases the blood sugar levels. So if this is a temporary phenomena, we can just control their diet or give them insulin if they are not eating well or if they are in ICU. Otherwise, we can start with very simple drugs like metformin. But main problem is not managing. Main problem here is the follow-up. We have to not just take care of the patient in the hospital setting. Should follow up the patient regularly, because if somebody has developed increased blood sugar levels, then definitely, as Ruchi madam was talking about impaired glucose tolerance, means that person is having a pre-diabetes or impaired glucose tolerance, and that person should be followed up regularly, maybe monthly sugar checkup or something like that, so that he does not land up in diabetes. So this gives us a opportunity or a window where we can diagnose the patient with impaired glucose tolerance and then follow up and make them aware so that they don't develop diabetes in future.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir.
Uh, if any other participant, if they want to ask, you can please ask to sir. Sir, meanwhile, I am having one question, sir, regarding one of the major problem which our society is facing, especially the females, like thyroid problem. It is also the sort of metabolic disorder, metabolic syndrome. So I just want to ask you, sir, ki if any of the patient is taking the medicine of thyroid regularly, so we can also read in the articles that if we do the regular exercise or we can control in our diets, so can we stop the medication after some time?
No.
No, na.
That is a
It
very
should become
very
like,
bad, and I would say lot of people, sorry to say, they claim various alternative therapy. People, they claim that if you take this medicine, आपका thyroid खत्म कर देंगे या आपकी दवाइयां हम बंद कर देंगे. No, it is not possible, because whatever these states we have seen, metabolic syndrome or other genetic causes also in thyroid disorder, the thyroid gland gets damaged permanently. So with good diet and good exercise, we can help it improve and make it more healthier, so that our dose does not increase with age or with our increase in body weight. So it will just help us to maintain the dose. It will not lead to increase in the dose. But when the organ is already damaged, it is producing less hormone levels, then we have to take extra replacement to make the hormone levels normal. So this is not basically treatment, this is replacing. Means our body produces almost 90 to 100 micrograms of thyroid hormone daily. If the gland is damaged, it is producing only 50. Rest 50 we are giving you in form of tablet, so that the normal is maintained daily. The daily requirement is maintained. So with good exercise, I say yes, you do good exercise, you keep a healthy diet, you keep yourself fit, so that the requirement does not increase and the gland becomes more active and it does not cause more weakness.
यस सर, एग्जैक्टली ये कंफ्यूजन रहता है क्योंकि अब बहुत सारे लोगों के दिमाग में कि एक टाइम बाद ये सारी चीज़ें बंद, बट मेडिकेशन भी ज़रूरी है इसमें, बट बाकी चीज़ों से हम खाली इसको एक रेगुलेट कर सकते हैं उसको. ओके, थैंक यू सर. We are also having our director sir with us, Dr. Suren Jain sir. So with his permission, I would like to request sir to share his views about today's lecture. Sir. Sir is busy in somewhere in meeting. So Ruchi ma'am,
Okay.
yeah.
Just say my namaste to your director, Mr. Jain sir.
Sure, sir.
Can I ask another question? Am I at liberty?
No, no, sir. Sure. Welcome, sir. Welcome, Sukhman, sir.
Sir, actually, me and my director sir were discussing regarding BMR. So, sir, how can we, make our BMR even better? BMI की नहीं sir, BMR हम कैसे और बेहतर कर सकते हैं? Apart from just going for exercises, how can we do that?
I don't think that any other easiest way is there to increase the BMR.
Just workout. Because sir, आलसी लोग हैं ना सर, chair वाला job है.
तो वही मैं बोल रहा हूँ ना कि see, you have to, we all have to come out of that mentality. We have to see, until unless you work, until unless you exercise or you make yourself very tired, you won't be able to increase your BMR. No, see, we had drugs. Sibutramine was a drug. No, almost it is banned almost a decade back, 2009 or 10, I think it was banned. This thing, it had a very good effect on increasing the BMR, but again the problem was that it had lot of psychological issues. People had psychiatric problems with it, they had suicidal tendencies with it. There was increased in basal metabolic rate to the level of that it had accelerated hypertension in patients. Normal person's BP used to shoot to 200, 220, 250, sudden cardiac arrest, sudden bleeding in the brain because of the sibutramine, because there was uncontrolled increase in the basal metabolic rate. So this has been tried, and thyroid hormone is one of the drugs which is commonly abused to increase the basal metabolic rate. Lot of people I know, to reduce weight, they take 25-50 micrograms of tablet because thyroid hormone improves your basal metabolic rate. But then this is like you say, this is all unnecessary. So a lot of studies are done to improve. Studies are there which are trying to make drugs where we can increase basal metabolic rate, as I showed about leptin also, that is also underway, because that is also main metabolic hormone. Then we have some receptors also, melanocyte receptors, which improve or increase our metabolism or basal metabolic rate. So studies are going on, but still I think there was a phentermine combination where USV had come with a US drug, but then again it was there in our market, but ultimately it was withdrawn because of lot of side effects. So I think till now we say work and only work, which can really help us improve our basal metabolic rate.
Thank you, sir. Thank you.
Thank you, sir, for your valuable lecture. It gives lots and lot of information about the metabolic syndrome. And here is a token of appreciation for you, sir. The certificate is visible on the screen, sir.
Yes, ma'am. Okay. Thank you, madam. Thank you. Thank you. Your appreciation is very valuable, madam. Thank you to your organizing team and to everybody.
Thank you, sir. And all are requested to fill below the feedback form, which is displayed in the chat box. And thank you, sir. With
Welcome.
your permission, I want to end this session, sir.
Yes, Manish. Okay.
Thanks for the comment,
Thank
sir.
you.
Thank you
Thank
so
you for
much.
your
It was very
cooperation.
nice and inspiring sessions for all of us, sir.
Thank you, madam. Thank you.
Thank you, sir.
Thank you,
Thank you,
madam.
sir.
Thank you.
So I request all the participants to be with us for the next lecture also. That is lecture 2 of day 2 of AICTE sponsored short-term training program, which will be taken by Dr. Reenu Yadav ma'am. And Ruchi ma'am, can you please stop the screen share?
Okay.
So I think the slide is visible. The timing of the lecture session is sharp and 11 p.m. So I request all the participants to be with us at 11:55. So for the smooth conduction of the lecture. Thank you.
Ma'am, joining just within minutes.
Okay, ma'am.
Ma'am, I'm audible, na? Surabhi, ma'am?
Yes, ma'am, you are audible.
Clear?
Yes, ma'am.
Okay, ma'am. Surabhi, ma'am, Madam Dr. Reenu, ma'am, is with us now.
Okay. Good afternoon, ma'am. Good afternoon. Welcome to our STTP program, ma'am. Ma'am, kindly unmute yourself. You're not audible.
Thank you so much. Thanks a lot.
Okay, Surabhi, ma'am, I think we should start now.
Yes, ma'am. Our participants are also, I think, joined, and the remaining will be joining. So, ma'am, we can start
Okay,
our
ma'am.
session.
Good afternoon to one and all present over here. On behalf of SIRT Pharmacy, I, Durga Pandey, welcomes our today's multi-skilled speaker, Dr. Reenu Yadav. Actually, there are so many achievements of Dr. Reenu. I am trying to cover some of them. Presently, Dr. Reenu presently working as principal IITM Department of Pharmacy, IES University Bhopal, having 14 years of rich administration, teaching and research experience. She has done PhD in pharmaceutical science in 2015. Achievement of Dr. Reenu. She's a guest of honor, face of the event of many events, academic programs, and features in 30 plus newspapers and magazines. Recipient of Young Scientist Award in Dubai 2015, Women Achiever Award China 2014, Young Scientist Mentor Award USA, recognition for her scientific presentation in France and Thailand Best Teacher and Academician Award, Excellence in Healthcare and Research 2019 Award, Social Activist of the Year, Women and Child Healthcare Award 2019 Dubai, 51 Influential Women, Special Awardee of Madhya Pradesh, Beauty and Brain Award 2019, India Star Award 2019, Women Icon Award 2019 and Global Brilliant Award 2019. Above all, she has proud that she is a woman of substance with her endless achievements in different fields. Dr. Reenu is a leading scientist and academician working in healthcare and pharmaceutical field from last 13 years. Her research experience includes herbal formulation, development, phytochemistry, and pharmacological screening of herbals. She authored 4 books and more than 35 research articles published in various national and international journals, guided postgraduate and PhD scholars for their research projects, received many grants and research grants, received many travel grant and research grants from ICMR, MPCST, CSIR New Delhi, CICS New Delhi, Department of Science and Technology, Department of Biotechnology, Government of India, and HR Ministry. So now I would like to invite Dr. Reenu to share their knowledge with us. Please welcome, ma'am.
Thanks a lot, Durga ma'am, for such a wonderful introduction. First of all, I would like to dedicate my sincere thanks to Dr. Surendra Jain, sir, Director, SIRT Pharmacy, for giving me this opportunities to present my views on this topic and that particular topic of interplay between health being, well-being, environment, and community pharmacy. And I also would like to dedicate my sincere thanks to coordinators, Dr. Ruchi Jain, Miss Durga Pandey, Miss Priyanka Rathor ma'am for their well coordinated. They have really coordinated very nicely with me. So thanks to all of you. Thanks to the whole team of the SIRT for being so nice with me. So starting with my presentation, first of all, I want to inform you all that recently I have joined FIP Vice team as a core team member. So in this presentation, I'll try to cover both aspects of I will try to touch the theme of this particular STTP, as well as I'll try to convey some mission, vision, and the working team goals of the FIP Wise team with all the young ladies. As I can see, many young ladies joining us on the screen. So I'll try to summarize some of the goals, mission, and vision of the FIP team as well. So let me share my screen. So is it visible to all of you? Okay.
Yes, ma'am.
Thanks. Thank you a lot.
Thank you, madam. Yeah, it's visible.
There is some issues from my side. As I have already discussed with Dr. Durga, that might be possible. I can have some issues with my laptop. So okay, this is fine now. So first of all, I would like to start my presentation with a big thanks to all the Corona warriors, especially all the pharmacists who have worked a lot in this period of the pandemic. So a big thanks to all the frontline Corona warriors, including our doctors and pharmacists as well as. I just wanted to take a moment to say thanks to all of them and a big thank you to all the Corona warriors. Again, my slide is creating some problem. So Durga ma'am, can I have slides from your side if possible? Because
Yes, ma'am. Yes, ma'am. Okay, ma'am, please stop share from your side so I can share PPT.
so wait a minute. Is it visible to all of you?
Yes, yes, ma'am.
Yes, yes.
So, ma'am, are you sharing slides for you from your side? So, can I have the next slide, please? So, as I told you, we all pharmacists have done a tremendous job during this pandemic time. Next slide, please, Durga ma'am. So we did all the work related to the drug therapies, the data analysis, research work, as we all are from the education field. So we never stopped ourselves for providing education to our students, drug storage work and the drug reviews. Even we pharmacists are upon the field as a frontline workers for the screening, for the patient screening for the COVID-19. And we did all the work, whatever was possible from our side. Next slide, please. This is few images I have collected from the internet, how we all pharmacists were working as a frontline Corona warrior. So I want to dedicate my sincere thanks to all the Corona warriors once again. Next slide, please, ma'am. Ma'am, can I have a next slide? So here, I personally feel that community pharmacies have a great potential to deliver the services aimed at the promoting health and preventing diseases in the communities, and are the well placed in the deprived communities also. So for me, if I talk about the community pharmacists, I personally feel that we are the first port of call, and for the pharmacists, the communication is the key between the patient and the doctor. They are the key. With the communication skills of a pharmacist, they can raise more and more waves in the field of pharmacy. So that they in the recent decades, I have personally feel that the role of community pharmacist has undergone the rapid expansion, with many services moving away from the traditional the supply function or the more patient focused approaches they had in reality in the COVID pandemic time. And indeed, in the many countries, the pharmacists now often arrange a health different kind of health promotional activities, and the community pharmacists and the health promotional activities in the 21st century, they are maximizing their roles, expanding their roles for the universal health coverage and the population optimization as well. So as per few literature says that nowadays there is a classical perception of the pharmaceutical profession in community, that pharmacies are facing worldwide extinction due to many factors. Maybe somewhere they are facing some problem due to the online pharmacies are emerging in the latest trend. And among the numerous factors, online pharmacies are increasing and gaining ground with their ability to facilitate customer demands. And but somewhere I feel nevertheless they are the end endangering the face-to-face contacts which we pharmacists are having, and that is affected by the online pharmacies and the building of the customer loyalties on the direct human interaction basis. So I personally feel somewhere this reduces the role of the actual pharmacists, like us, we are running the who are running the shops, their shops, and they are reducing pharmacists to mere they are reducing their mere commercial figures, and the approach which was the patient care centered care communication is emphasized, as well as the essential element to the build a solid and appropriate interpersonal relationship with the patient, and to make the consultancy process effective and strengthen the pharmacist professionalism and community pharmacy. Somewhere these kind of pharmacies are affecting the pharmacists which are opening the shops and serving as the frontline corona warriors. But personally I feel the pharmacist is still having the face-to-face contacts with the potential consumers, and they are having still one key in their hand, that is the communication, their communication skills. So I personally feel that the progress of the scientific and technological knowledge and the social, economic, and political changes, including the demographic growth and the development of national healthcare system, and the birth of the clinical pharmacy and pharmacist care, have all the contributed to the evolution of the pharmaceutical profession, which began to expand into the other sectors as well, like community pharmacies, hospital pharmacies, different kind of pharmaceutical industries, regulatory controls, drug management, and academic activities as well. So among these, the community pharmacists have been defined as the first port of the call. Among the professional in the healthcare sectors, thanks to them for their ease of accessibility, because they are in the contact of the general public, and they can be described as the primary healthcare or the primary care pharmacist. Thus, because these pharmacists doesn't need any kind of appointment to meet them, they are easily accessible to the general public, and they are continuously coming into the contact with the general public. So, what the pharmacist acts as the intermediary between the doctors and patients, and the patient, by providing both medicines as well as free advice with the medicines. So, and that too without any need for any kind of appointment. So, I feel although the pharmacist can be the first point of the contact for the same for healthcare consumers, but they are relatively nowadays a bit underutilized sources and almost invisible in the recent healthcare in the recent healthcare policies. So, so I feel next slide, please, Durgama. Uh, so, um, with the in order to enhance their professionalism here, that pharmacists have to begin reinvent themselves, finding the solutions to expand their role into the community pharmacy. In general, they focused on the establishing of a closer relationship between the patient, enhancing their professionalism by the self-assuming and the great responsibility, providing the appropriate advice, or they could have their decision-making power. So with the aim of preventing, protecting, and the promoting the patient health, the pharmacist has a clear and easily understandable information about the correct use of one particular kind of drug. It is maybe possible that contraindications, so that the patient gets the maximum benefit from it, that we pharmacists are basically the problem solving professionals. For an example, as any medication experts prepares to dispense the opioid prescription, they can play a key role in contributing to the safe opioid use among the patients, and by educating them on the risk associated with the opioid use. So, regarding their disposal medication and consequences of sharing the medications with the another person. So, I feel this kind of personalized communication can give these kind of community pharmacists up to great heights. So, I personally feel here that communication is a really key, can serve as a key for the community pharmacists nowadays. So how there are several consequences of the pharmacists as unskilled and or the skilled communicators. For example, an unskilled communicator reduces the patient adherence to the therapy and decreases the patient satisfaction, and insensitivity to need of the customers could be there because of unskilled communicator, and job satisfaction is more there, and they could have a loss in the business. Rather, I could say that if the pharmacist is well skilled for the communication, this can be improved the patient out. This can be give an outcome as an improved patient condition and increase the patient satisfaction, and it can also provide the more patient friendly pharmacy practices. So it also enhances the pharmacist satisfaction, and it ultimately helps to increase their business as well as. So I feel this kind of the communication can play this kind of role in the what I can say, the re-establishment of the pharmacists nowadays. So in conclusion, I can say that since one of the key roles of the pharmacist in the community pharmacist is focused on the counseling communication, is essential for the pharmacist in order to fulfill her or his primary ethical duty, and communication play an important role in the uplifting the pharmacy professional as a frontline corona barrier. So with this, I think we pharmacy fraternity is divided nowadays. After joining FIP as a working group member, I have feel that our pharmacy fraternity is having two kind of pharmacists, obviously a male and a female. So here, I would like to give more emphasis on the condition of women in the pharmacy. So here, from this point of time, I would like to discuss the condition of women in the pharmacy. So personally, I feel that we personally I feel the condition of women in the pharmacy is after the corona pandemic is it's somewhat deteriorating, because I personally feel that this pandemic situation served as catalyst in the gender inequality quotient. So discussing their present condition, we women in the pharmacy make up to 50% of population and represent approximately half of the labor force in the pharmacy field, and approx 40% females are the breadwinners of their homes, and they having a decision making power over the purchasing of a family up to 70 to 80%. So most of them are having B.Pharm and M.Pharm's degree, and few like 40% are having doctoral degrees also. Next slide, please. So in the reality, we think we women are behind the success of man. Obviously, a female runs a family, so we feel we women are behind the success of a male. But in the reality check, next slide, ma'am. In the reality check, this is my personal feeling that in the reality, women lives are remains still invisible. Invisibility in the terms of they are still not contributing as they are having potential to contribute. It means they are not utilizing their full potential in the growth and development of their family as well as for the nation. So geographically, men and women are landing in the same earth, but I feel they are still living into the different worlds. Next slide, please, ma'am. So here, this is because we deeply we are having the unequal sharing of the burden, family as well as professional burden. We are still having the unequal sharing of the work, and with this, we females in many areas, not the urban and rural areas, because whenever we talk about the women empowerment, or we talk about the women condition in the society, we always stick with the area in which we are living. If we are living at the area of at an urban area, we think women are empowered enough, they are educated, they are having a well access to the healthcare services, and they are having the physical and financial resources, they are economically developed. But if we move to the rural areas, the situation are still different, situation are still out of control. Still the females are not having a good access for the education, a good access for the healthcare, and they are not still having the economic and financial resources and the financial freedom. Next slide. So we women do more than 67% of the hours of work, and earn 10% of the world income, and own only 1% of the property of our houses. So this is the current scenario I feel we women are having. We women hold between 10 to 20% managerial and administrative roles, and 60 to 80% food in developing countries produced by the women, and still women are paid 30 to 40% less than male for the comparable work. And if we talk about the seniority position, I still can see a pyramid like structure, where the more and more females at the base, means more females are at the lower level work, and only few females are at the top position as a CEOs, or as the company holders. So I can still see the a pyramid like structure when we talk about the organizational structure. Next slide. So this kind of inequality feeling, where we women are working by giving our heart and soul to work, if we are not appreciated, if we are not achieve whatever we want to achieve, this tends to feel some mental issues or some health issues. So as per the literature, there are several females which attempts suicide. This is two times than male. So their anoxia, the females tends to have the problems like anoxia, and 1 out of 12 women will develop alcohol dependence during their lives, and this is a hidden fact. There are two folds are likely as a men develop depression. So there are more tendency in a female to develop a depression. Again, the same scenario in the anxiety disorders, and they are having females are this is a hidden fact that females after a childbirth, they got the traumatic stress disorders also. So this is the situation of the women mental health nowadays. Next. Next. So I feel today's women are more independent. Today's women are more confident. I can say today's women are more independent, more educated, and they are having awareness of this the political issues and these different kind of social issues. So she is aware, well aware also, but and they are confident, they are having the technical skills to run a business, to run any kind of organization. They are having an integrate life and the careers. They are working efficiently with male, and they are supporting at the workplace male as well as females. But I personally feel where they differ in the perception of the society, the kind of environment they are having in their organizations, and they are somewhere lacking into the network. Which kind of network they are lacking? We males are socializing much in comparison to females. So male are more tend to build a greater network, but females are somewhere lacking into the networking quotient, and the opportunities they are getting for the to get leadership positions are less in comparison to a male. Next. Next. So if I talk about the women in pharmacy, specifically about the pharmaceutical sector, there are 76% of healthcare workers are women, and 18% of hospital CEOs are women, and 24% of top executives are women. 12% executives are CEOs, and still you can see that 70% of middle level leadership position is still acquired by the females. So I still feel that the broad area, the broader portion, that is 71%, is for the middle level leadership. That females are still considered best for the middle level leadership position. As I personally feel that pharmacy profession is known to be one of the more attractive profession for the women, and with the flexible part-time working and the kind of work a women want to have. And however, research shows there are different kind of gender disparities between a male and female in the pharmacy workforce. So these kind of disparities includes the career progression and in the seniority level, where women are overrepresented at the student level, at the middle position level, at a staff level, but they are underrepresented when we talk about the leadership positions in the broader aspects. And the studies also have also shown there is a clear gap between the pharmacy profession in terms of the salaries, what they are earning. And like many profession, our pharmacy profession is also the male dominated one. However, women nowadays coming more and more into this particular profession, but still there is at the top position there are less females in comparison to a male. And they are still is there is as underrepresentation of women in the decision making roles or the roles with the authority and power in the pharmacy profession. This pattern is from unique pharmacy mirrors in general social kind of disparities are there. So next slide please. So this was the scenario before the pandemic situation, but this pandemic situation boosted this inequality somehow, because personally I feel in the last if we see the data in the that I have shown the data that was of 2010 to 2013, but the condition and the situation of women become nicer in these last 10 years, and this was becoming better and better. I'm not saying the things are dark at the both side. There is a brighter side, that more and more women are coming, more and women are coming in this field, and they are getting opportunities. They are stepping out from their houses to earn good, but still we were going on the better path in last 10 years, and I was expecting that the situation will be better in the next 10 year also. But due to this somehow due to this corona pandemic, this pandemic situation give a negative effect, or the act as a catalyst in this inequality issues. So there are if I see the COVID-19 and women, I can see the 7 problems faced, or the 7 issues faced by the girls and women during this pandemic. So these issues are basically economic issues, healthcare system, and their health and well-being issues. So if I talk about the economic issues, there are higher rates of the job losses are there, and reduce the financial independence and the future prospects, as they are not getting the full salaries. So there may be they couldn't feel the this kind of that financial independence that they are feeling prior to the pandemic situation. And there must be a greater burden of domestic care and the care work that we females were working from the home. So we have to manage our houses. We managed at that lockdown time our houses, our kids, and the academic work we were doing as in routine. So we was overburdened at that time. And after the lockdown, if I talk about the post lockdown situation, the condition is almost same. And because still we females are managing our houses, we still managing our kids, because we are still not getting the house helps. So these kind of situation we face. So if I talk about the healthcare system, few females was working as the frontline corona warriors, so it increased the risk for the frontline healthcare workers, and they reduce access to the vital health services and the exclusion from the potential COVID-19 treatments. And I personally feel I went to the some slum area for the distribution of the sanitary pads, where I found that a few ladies of the slum area, as well as if I talk about the middle class the ladies, they were not having access to the sanitary pads at that time. So these kind of health issues we faced. The next one is the increase in the risk of the pregnancy related deaths, and teen age pregnancies was there. And it also boosted in sexual, physical, and domestic violence and exploitation as well as. And in this pandemic time, uh, in this time of crisis, when resources are strained and the institutional capacity is limited, so women and girls face the disappointment, some disappointing facts that with far reaching consequences that they are only further amplifies in the context of fragility, conflicts, and such kind of emergencies. Next slide, please. So if we talk about the gender inequality in the workplaces they are having, so we all are basically mostly we 40% workforce of the pharmacy field. Pharmacy, if I talk about the academia, we all are mothers. We are taking care of our kids. Maybe we are living into the nuclear family and we are managing our kids by sending them into some crèches or something. In the corona pandemic time, all the crèches were closed. Even still all the crèches are closed. Even we females are not feeling safe to send our kids into the crèches because of that pandemic situation. So mothers are more likely to have permanently lost their jobs, and 14% were more likely to have been laid off since the beginning of the pandemic than in comparison to a male. So the most affected sectors were the hospitality sectors, education sectors, healthcare, and the retail sectors, in which the vast majority of workers are female. So these sectors are highly affected, and the healthcare workers also facing the pregnancy discrimination. As a result, this growth has threatened to the reverse years of the progress towards the gender inequality about which I was talking about. So a few experts having fear that possibility of returning to that era of to that society where women are staying at home, and while only men go to the work. Next slide. So few other situation which we females faced with whether we are students or we teachers or the pharmacy teachers, that we pharmacy teachers were teaching from the homes with managing our houses and the kids. Female students were learning from the home. They were also under the stress because they has to help their parents for the household things. And the single if the parent is single And with the loss of job and to the support education, studying, working, parenting, all things affected in this pandemic time. And support the single parents are also supporting the family where they are not having any kind of earning resources. Next one. So as per the UN goal number 5 is also having gender inequality in their agenda. So ending all kind of gender discrimination against women and girls is not only the basic human right, but it is crucial for the sustainable development as well. Because I personally feel women contribute, if a woman is financially independent, she is involved in the financial activities, not only the family will raise, but the whole nation will raise. As we can say, in India, we females are only 37% females are engaged with the financial things, but in the China 80% of females are financially independent, and they are either entrepreneurship or somehow related with the financial activity. So you can see the growth of China, where China is standing now. So this it's proven that empowering of women and girls helps economic growth and development of the whole nation. So that UNDP has made a gender inequality center to its work, and we have seen unremarkable progress in the past 20 years. There are more girls in schools now in comparison to the 15 years ago, and most regions have reached gender parity in the primary education as well. So they are also saying that situation are getting better and better, and in few days, in few years, maybe we शायद हमें ये women empowerment and gender inequality topics पर discuss करने की जरूरत ही ना पड़े. Next one. So here, as I discussed the UNDP's goal number 5, the FIP is also having a team, that is FIP Women in Science and Education, which is chaired by Clary Thompson. Next. So there are several goals of the FI Equity RX, that we are having different kind of modules, and the one is the Equity RX, which is working upon the equity and equality related issues, and they are basically leading the champion. They are the champion for the championing women in the global pharmacy, and they are working upon the empowerment of women both within and beyond the health workforce, and they are investing in women, whether through the female workforce or across the settings and the stages, or through the women caregivers in the communities. So presently they are focusing upon the 3 goals. That one, first one is promoting the equity in the pharmacy workforce, and championing the women in science and education, and empowering the women as the informal caregivers. Next one. So as I was talking about the Equity RX, the agenda of the Equity RX of promoting equity in the pharmacy workforce. So the average female proportion of the total global pharmacy workforce will increase over 70% by 2030, it is expected. And the promoting equity in the pharmacy workforce is needed no more than ever to utilize women's role in the deliver better medicines related to health for all. And all the countries are having the clearest strategies for addressing the gender and diversity inequalities in pharmaceutical workforce. And this is continued with the education and training and the career progression and with the opportunities. Next one. So there are some priority areas on which FIP Equity RX is working with promoting equity in the pharmacy workforce through the FIP Workforce Development Goal 10. Workforce Development Hub and champion women and in science and academia through the FIPY's team, and empowering women as an informal caregiver through the FIP working group on male and for the on the women and the responsible use of medicine. So these are few agendas which FIPY's team is covering. Next one. Next one, please. Next one. So this is the basic agenda of the FIPY's team, that to help achieve the gender equity for the women in pharmaceutical sciences and education, and empower them to achieve their full potential, and to attract the students and young women into the field of science or education. And for this, we have launched the FIPY's campaign. Next one. So one of the agenda of the FIPY's team is empowering the women as an informal caregiver, because we personally feel being a women, we are the better caregivers. We are not only working as a nurses, we are not only working as the pharmacists at our workplace, but also non-professionally, we are the closest to the healthcare professionals more than often, because we in our houses we take care of our kids, we take care of the elder persons, and in general the women tends to seek treatment and go to the doctors or the pharmacist office more frequently than a man do. So it is observed that the females are much more conscious about the healthcare of their family, from family, kids, and the elder person. So this is one of the goal of the FIPY's team, to empower the women as informal caregivers. Next one. Next one. So these are 7 ways of balanced teaching. Although we all the females or all the world was into the tremendous shock due to the pandemic situation, and there we have to work for our homes, and we have to go for the new to learn newer technologies at the same time, as we were never using these kind of technologies earlier. So we females faced lots of burden during this pandemic situation, and somewhere they couldn't made a balance between their professional and personal life. So here, these are few strategies suggested by Dr. B. Suresh, PCI president. He suggested these 7 strategies how to make balance between your teaching task. So according to him, the strategy number 1 was the accept that you whatever resources you are having, accept it. The strategy number 2, accept that the quest for the perfectionism maybe your can become your enemy. Strategy number 3 was the work with other teachers, and strategy number 4 was create professional and personal as well as professional learning network. Strategy number 5 was work smarter, not the harder. Strategy number 6 was remember that small changes led to bigger ones. And the last one was keep balance in between your personal and professional life. Next one. So strategy number 1 was accept that you will never have much time or resources as you would like to have. We tends to say that if we could get this thing, हम better कर पाते. If we could get this thing hum better kar pate. But first thing is the about your attitude, the kind of attitude you are having towards your work. If you are having positive attitude towards your work and the right kind of attitude towards your work, that means whatever I am having, whatever resources my institution is providing to me, I am going to utilize the same kind of potential, and I'll show my best work among by utilizing these resources only. So we have to have the practical acceptance about the things. We have to be authentic and true. We have to live in here and now, and we have to be autonomous. We have to work autonomously and independent, and we have to have a strong sense of purpose. And obviously these kind of situations are not conventional, so we have to break the barriers of these conventional things. We have to be unconventional and spontaneous for accepting all kind of changes. Means if there is a change in the teaching methodology, we have to be eager to adopt or be with all kind of changes. So the kind of flexibility in our mind we have to develop. And obviously the last one is never stop learning, because in this pandemic situation we learned all the functions of internet. We utilize our mobile phones fully. We learned lots of apps. We learned how to prepare different kind of slides. We learned the different kind of strategy, how we can attract to the students into our online lecture. So if we are all time keen for the learning, the we can find or we can do our work in a suitable manner. Next one. The next one is accept that the quest for the perfectionism may be your enemy. Once I was when I was doing MBA, once my teacher told me, Dr. Neeraj Sharma, who is the dean at management at People's University at this time, he once told me avoid perfection. So I was asking, sir, everyone tells that be perfect, but you are saying avoid perfection. Why? So he suggested me, when you are trying to be multitasking, this pandemic in this pandemic situation, we try to be multitasker. We try to be a good home manager. We try to be a good at our work also. So we try to be a multitasker. When you are becoming multitasker, at that time, if you are searching for the perfectionism in your each and every work, you may be in a big stress condition. So it is not good always to search for the kind of perfectionism. So this time you have to avoid perfectionism in certain kind of work. Next one. So the next strategy is teachers supporting teachers. This is I'm talking in the terms of our colleagues. If suppose if I am not that much technology free, so one teacher can support another teacher to learn these technologies. If we am not free at the time for the online classes, or I have not prepared my PPTs, I have not prepared for the kind of things I am supposed to do. So at the time we have to identify at least one the best colleague who can replace you at that time. So here we teachers can to support the other teacher in that informal manner. So in this, I request all the ladies to build up a network of the ladies, of the pharma ladies, who can support informally to each other in these kind of the crisis. And in the case of, suppose one female teacher is ill, or they are in their stress condition, so that other can come and take her responsibilities as a that particular faculty's responsibility. So this kind of network building, this kind of supporting environment can help us to build the right kind of environment for the female faculties. Next one. So, as I discussed the last strategy, strategy number 3, we have to create a personal as well as professional learning network. So, what is this learning network? As I told you, that we females are somewhat lacking in terms of the networking. We are not. If we talk about the male, our male colleagues are having a big network. So if they are not having certain kind of topics, they are not having certain kind of facility, they may uh, search for the help from the outside. But what we female do, we female are not having such kind of network, so we get puzzled in our daily work. So we have to collaborate to enhance ideas and the kind of activities that they can make a good plan or work. So we have to prepare a good network, including our peers, our co-workers, our supervisors, our experts, and other kind of professionals. Next one. The strategy number 5 is the be a work master, not work smarter, not the work harder. Because if we work harder without having any kind of goal, any kind of vision in our mind, this can be uh, affect hardly to us. So stop working for more hours and start working smartly, in a smart way. Make sure that your family, colleagues, and students are on the same page as you are. Improve your time management skills. Measure your work in the result form. If you are working and results are not coming, so your all the hard work is worthless basically. So if you are working, your work should be result oriented. And the you have to automate your task and stop the sometimes you have to, if you are on a one automated working mode, you have to stop at that time, being as try as a multitasker. So this is my personal advice to all of you: work hard but try to be a smart worker. Next one. The next one is, remember that small changes lead to a bigger ones. Sometimes we start learning anything. We learn one function and say, "यहाँ तो बहुत सारे function हैं. I am not able to learn all this." Start with one. One is always the beginner. That is the lead point who can lead the next change. So have a positive attitude about your work. Always have a positive attitude about your learning skills, and create and stick to your routine. Recognize the overcome and the barriers, and keep your sense of perspective to prevent and manage the crisis, and manage resources effectively and efficiently, whatever resources you are having. Next one. So the last strategy is to keep balance into your personal and professional life. As I suggested all the females earlier, that we females are having has to have the dual life, personal as well as professional. So we have to learn this art of living life, how to balance, keep the balance in between your both the phases, your both the areas of working. So it is never easy for a female to be a full-time worker or to be a 24 hours worker. So you have to seek for the alternatives, you have to seek for the other things, what can facilitate your work in a nice way. So if and one more thing with which comes in the mind of our in the mind of females, that if we are not giving time to our family, we feel a sense of guilt, a sense of irresponsibility, that we are not giving time to our family and we are only sticking to our the professional life. But we, in that time, we must learn the art of emotional balance, as well as the balance in your personal and professional life. Next one. So, taking all these things into the mind, the disparities, the inequalities, the emotional kind of things we females are having, FIP designed the Equity RX program with the certain different work groups, different sub work groups, that is equity and equality in workforce, and the Women in Science and Education, that is FIP WISE team, and Women and Responsible Use of Medicine Working Group. The next group we are having is FIP Equity Digital Events Group, in which we celebrated the virtual September, in which we had the largest gathering of the females, or the pool of the females from all over the world, the FIP Equity RX collection, the partnership buildings, and the FIP commitment to equity and equality teams are there. Next one. Next one. So again here one more once again I want to share the agendas of the FIP WISE team. The agendas of the FIP WISE team is to help achieve equity by building the solidarity network, to empower the women and pharmaceutical science and the pharmacy education to achieve their full potential, and to attract the students and young women into these fields. This is the link for the FIP WISE page. So here you can download the FIP WISE social media packages, in terms of you can, if you want to be a part of our team, you can log in into the particular website. Next one. This is whatever we did in during 2019 and 20. These are a few actual physical events. This is a FIP WISE team meeting where chairperson Dr. Clary Thompson is there. So these kind of events, through these kind of events, we are trying to the network building among the women all over the globe. Next one. These are different programs we organize virtually in the September month, and we called it the virtual September, in which we had the FIP WISE launch on 11th of February. Few online events we had the Women Virtual Leadership Lab, and here this FIP WISE program is roaming around the world right now. Here you can see a small photo which I have pasted here, is an presentation given on the same topic by our honorable PCI president Dr. B. Suresh sir. He addressed the same issue into the various platforms and helped our FIP WISE team to grow nicely. Next one. So this is again few virtual programs we had during the month of September and October. Next one. This is few pictures and clips where we celebrated the year-ending meeting of 2019 and 20, and we all raised a toast on the name of the womanhood. And these are the few clippings of the virtual September, where we had the virtual women leadership labs. This is the FIP WISE working group members list, in which I have my name in the building confidence and competence team as a working group member. Next one. Next one. So this is all work we did till the 2020, and if FIP WISE 2020 roadmap is already there. In this, we are trying to trying to organize few leadership labs for the leadership skill development programs in the building confidence and competence team, act for the enabling work condition, and we would like to support young women in the pharmacy student, and we are also having this year FIP Young Women in Science and Science and Education Awards. And one more thing, wider implementation of FIP development goal team 10 expansion is there. Next one. So with this, I would like to invite all the ladies to support the global movement for the women in science and education. And I would like to invite more and more ladies in the pharmacy field to join the group and work together for supporting this particular movement. Next one. So again, I would like to request you all to stay at home still, because still coronavirus stories are coming that we are having a new strain and something like that. So still we have, whether we are going to our work and performing our work at the workplace, we have to be conscious. Next one. Next. So previous slide, please. So here one slide, I want to show all the ladies that we are having many things. We are doing many rituals like Karwa Chauth, like Diwali, and many more festival. And we prepare lot. We do lots of preparation for this. But what about us? You must have heard about the Me Too. But why we are not celebrating the Me Day? What is Me Day? The me first. Personally, I think if a woman is healthy in a family, her whole family will be healthier. So because the family, the women is the basic center of the family. If women is taking care of her health, I think whole society is going to be healthier. So let's, all the ladies, let's celebrate a Me Day. So what is a Me Day? Next slide. Back. I think I lost the slide. What is a Me Day? Take one day for your health checkup. Take one day for your health checkup. Which kind of health checkups? Go to the doctor if you have crossed the age of 40. Please take one day for your health checkups. Go to the doctor and have screening for the have mammography for the breast cancer, and many few other issues we women are having. So like we are more prone to the osteoporosis kind of the diseases for our bone health. So go to the doctor and take one day for you only. So this is the basic funda behind the Me Day or the Me First campaign. So with this, next slide. So with this, I would like to dedicate my sincere thanks to all the all the female participants for listening me, and for the male participants, I also would like to dedicate my sincere thanks that they have given their time to listen all these things. And somewhere I request all these all my colleagues to help females at their informal ways as possible. Thanks all of you once again.
Thank you, Dr. Reenu, for such a wonderful lecture in short-term training program of SIRT Pharmacy, sponsored by AICTE. You cover different areas like women in pharmacy, mental health of women, and about current pandemic situation of COVID-19, gender equality, about teachers and teaching methodology, and how we can balance our life in this situation. So I really thankful to you to give your valuable time with us. Now I request to Priyanka Chaturvedi madam to share a certificate of Dr. Reenu as a token of love. Ma'am.
Much. Thank you so much, Dr. Durga, for this beautiful appreciation.
Okay, any participants, if any participants want to ask questions from Reenu ma'am, they can ask, please. Any participants? Okay, ma'am. Thank you so much. Again, thank you for giving your time.
Thank you so much once again for giving me opportunity to discuss with the FIP.
Welcome.
Thanks a lot, all of you.
Thank you, ma'am. I think um,
The feedback link will be shared to the participant in their respective WhatsApp group. Durga ma'am, please kindly share the feedback link of today's both the session. And kindly fill the feedback form. It will be shared in the WhatsApp group. And tomorrow there will be again lecture of the faculties. The schedule for it for the same will be sent in the group. So stay connected with us for the day 3 of AICT sponsored short-term training program. Thank you so much for joining with us. Thank you once again to all the participants.